Welcome to Healthy Life Channel, where we explore vital topics to keep you well informed and prioritize your well-being. Like this video if you're intrigued by natural health solutions. If you're new here, hit subscribe and enable notifications for our latest updates. Today, we face a question of paramount importance, one that could genuinely save lives. Pancreatic cancer, often called the silent killer, is an exceptionally dangerous disease due to its subtle onset and late-stage detection. The pancreas, an organ located deep in the abdomen behind the lower part of the stomach, plays a vital role in the body. It produces hormones such as insulin to regulate blood sugar and enzymes to aid in digestion. Pancreatic cancer begins in the tissues of this organ, growing silently and making early detection incredibly challenging. This difficulty arises because the symptoms are often vague, slow to appear, or easily mistaken for common, unrelated health issues. Understanding the symptoms of pancreatic cancer is critical. Recognizing these warning signs early can significantly impact treatment outcomes, potentially improving survival rates and quality of life. Today, we will discuss 10 critical warning signs of pancreatic cancer that should never be ignored. Think of these signs as clues that your body is sending, indicating that something may not be quite right. Seeking medical help promptly upon noticing these symptoms could mean the difference between early diagnosis and advanced stage disease. Early intervention can turn the tide, allowing for more effective treatment and a better chance of recovery. The pancreas's deep location in the abdomen makes it treacherous, in the sense that pancreatic cancer often goes unnoticed until the tumor grows significantly or spreads to other parts of the body. This late detection is a major reason pancreatic cancer is frequently diagnosed at an advanced stage. The most notable challenge is the non-specific nature of its early symptoms, which can easily be dismissed as minor health issues. For example, persistent stomach discomfort, unexplained weight loss, or chronic fatigue may not immediately raise alarm bells. However, these subtle signs could indicate a serious underlying issue, such as pancreatic cancer. Unfortunately, delays in seeking medical advice give the cancer time to progress unnoticed. By being informed about the symptoms, we empower ourselves to make better health decisions and act swiftly if something feels off. Awareness and vigilance are essential tools in detecting pancreatic cancer early, increasing the chances of effective treatment and improved outcomes. Let's dive into the discussion of these critical symptoms, starting with jaundice, a visible sign that demands attention. But first, please give this video a like. The more likes it receives, the more YouTube will distribute it to people who might not have access to doctors or hospitals. Also, share the video with your friends and family. 1. Jaundice. Jaundice is a condition characterized by the yellowing of the skin and the whites of the eyes due to an elevated level of bilirubin in the blood. Bilirubin is a yellow pigment produced when the body breaks down old red blood cells. Normally, the liver processes bilirubin by mixing it with bile and eliminating it through the digestive system. However, when the liver is unable to process bilirubin effectively, or if there is a blockage at any point along the bile ducts, channels that carry bile from the liver to the intestine, the excess bilirubin can accumulate in the body. This accumulation leads to the yellowing of the skin and eyes, a condition known as jaundice. Jaundice itself is not a disease but rather a symptom indicating an underlying health problem. There are several reasons why someone might develop jaundice. It can be caused by liver diseases such as hepatitis or cirrhosis, where the liver fails to properly break down and process bilirubin. Additionally, jaundice can result from an obstruction in the bile ducts, often due to gallstones or, in severe cases, cancers that press against or block these ducts, such as pancreatic cancer. Jaundice in adults usually signals a significant health concern that requires medical evaluation. In addition to yellowing of the skin and eyes, jaundice can be accompanied by other symptoms like dark urine, pale-colored stools, and itching, which can provide clues to doctors about the underlying issue causing the jaundice. The treatment for jaundice must address the root cause rather than just the symptom itself. If the problem that caused the bilirubin buildup is not treated, jaundice will persist. This awareness of jaundice and its implications is crucial because it serves as a clear indicator from the body that something significant is wrong, especially with the liver or bile system. Recognizing these signs early and seeking medical attention can make a critical difference in diagnosing and treating the problem before it progresses to more severe complications. 2. Unexplained weight loss. Unexplained weight loss refers to a significant and unintended reduction in body weight that occurs without any changes in diet, exercise routines, or conscious efforts to lose weight. This phenomenon might initially appear as a welcome surprise to some, but it can often be a warning sign of an underlying health condition. People might notice their clothes fitting more loosely, or the numbers on the scale dropping unexpectedly, without being able to pinpoint any specific reason. This type of weight loss can happen suddenly or gradually and indicates that the body is not receiving enough energy from the diet or is burning calories at an unusually high rate. It can be linked to various medical conditions. For example, an overactive thyroid, hyperthyroidism, diabetes, depression, or digestive diseases might cause a person to lose weight. However, one of the most concerning causes of unexplained weight loss is cancer, including pancreatic cancer. In the case of pancreatic cancer, several factors contribute to this symptom. The pancreas plays a vital role in digestion by producing enzymes that help break down food. When cancer affects the pancreas, it can disrupt this process, leading to malabsorption of nutrients and subsequent weight loss. Additionally, a tumor in or near the pancreas may press against the stomach, creating a sensation of fullness even after eating very little. Furthermore, cancer in general accelerates the body's metabolism, causing it to burn calories more rapidly than normal. Unexplained weight loss is a symptom that should never be ignored, especially when it is accompanied by other health issues. A loss of more than 5% of body weight within 6 to 12 months without a clear cause is considered significant and warrants medical evaluation. Identifying the underlying issue early can lead to timely treatment and better health outcomes. If you notice unexpected weight changes, it's essential to consult a healthcare professional to determine the cause and address any potential concerns. 3. Abdominal pain. Abdominal pain refers to discomfort or pain experienced in the area between the chest and the pelvis. This region houses numerous vital organs, including the stomach, liver, pancreas, and intestines, making the causes of abdominal pain diverse and sometimes challenging to identify. The nature of the pain can vary significantly. It may be sharp, dull, intermittent, or constant. Its location and intensity can provide clues about the underlying issue, but in some cases, the cause may remain unclear without further medical evaluation. While abdominal pain is a common symptom of less severe conditions like indigestion, gas, or a stomach virus, it can also signal more serious health concerns. One notable and concerning cause of persistent abdominal pain is pancreatic cancer, a condition where this symptom often starts in the upper abdomen and may radiate to the back or sides. This pain is typically progressive, becoming more constant as the disease advances. In pancreatic cancer, the discomfort is often linked to a tumor pressing on surrounding organs or nerves. It may worsen after eating or while lying down due to increased pressure in the abdominal cavity. Additionally, abdominal pain associated with pancreatic cancer might occur alongside other alarming symptoms such as jaundice, yellowing of the skin and eyes, unexplained weight loss, or changes in bowel habits. The presence of these accompanying signs significantly increases the likelihood of a serious underlying condition requiring immediate medical attention. Even if the pain seems mild or intermittent, it is essential not to overlook it, particularly if it persists or occurs alongside other symptoms like nausea, vomiting, or changes in stool appearance. Abdominal pain, especially when paired with systemic signs, could indicate a pressing health issue. Seeking timely medical advice can lead to early diagnosis and better treatment outcomes. 4. Digestive issues. Digestive issues refer to a range of symptoms that affect the gastrointestinal tract, which spans from the mouth to the anus. These symptoms often include nausea, vomiting, diarrhea, or constipation. They can also manifest as changes in the stool's consistency or appearance, such as loose or watery stools. The severity of these digestive problems varies widely, from mild discomfort that temporarily disrupts daily activities to severe conditions that significantly impair health and overall well-being. Common causes of digestive problems include dietary choices, stress, or minor infections. However, they can also indicate more serious underlying conditions such as chronic digestive disorders, diseases affecting the organs involved in digestion, or even cancers like pancreatic cancer. The pancreas plays a critical role in digestion by producing enzymes that break down fats, proteins, and carbohydrates, facilitating nutrient absorption in the body. When pancreatic cancer disrupts this function, it can lead to a host of digestive symptoms. For example, in pancreatic cancer, nausea and vomiting may occur due to a tumor obstructing the stomach, preventing food from moving through the digestive system efficiently. Changes in stool appearance, such as steatorrhea, fatty stools, may also be observed. This condition arises when the pancreas fails to produce enough enzymes to properly digest and absorb dietary fats. Fatty stools are often pale, greasy, and foul-smelling, indicating poor fat digestion and absorption. Additionally, digestive problems linked to pancreatic cancer frequently include abdominal pain and bloating, particularly after eating. This is due to the body's reduced ability to process food effectively without adequate pancreatic enzyme production. These symptoms not only cause physical discomfort but can also lead to significant nutritional deficiencies and unintentional weight loss, further compromising the patient's overall health. The impact of these digestive symptoms extends beyond physical discomfort. They can substantially lower the quality of life. It is crucial to pay attention to persistent digestive troubles, especially when they occur alongside other symptoms such as abdominal pain, jaundice, or unexplained weight loss. Prompt medical evaluation is essential to address these issues and identify any underlying conditions that may require treatment. 5. Loss of appetite. Loss of appetite, also known as anorexia, refers to a significant reduction in the desire to eat. While this can occasionally result from temporary factors like stress or minor illnesses, a persistent lack of appetite may signal a more serious underlying health issue. This condition not only affects eating habits but can also lead to profound weight loss, nutritional deficiencies, and a weakened immune system, impairing the body's ability to recover from illnesses. Several factors can contribute to loss of appetite. These include psychological conditions like depression and anxiety or physical causes such as gastrointestinal disorders, chronic diseases, or infections. More critically, a loss of appetite is strongly associated with various cancers, including pancreatic cancer. In the case of pancreatic cancer, this symptom may arise for multiple reasons. 1. Tumor effects. Tumors in the pancreas or surrounding areas may exert pressure on the stomach, creating a sensation of fullness even after consuming small amounts of food. 2. Metabolic changes. Cancer can alter the body's metabolism, leading to decreased hunger. 3. Taste alterations. Substances released by the tumor may cause changes in taste or smell, further diminishing the desire to eat. 4. Treatment side effects. Treatments like chemotherapy may exacerbate appetite loss due to side effects like nausea or altered taste perception. The loss of appetite in pancreatic cancer is especially concerning because it can contribute to cachexia, a syndrome characterized by severe weight loss, muscle wasting, and metabolic dysfunction, even when calorie intake appears adequate. Cachexia can significantly affect a patient's strength, immune response, and overall quality of life, making this symptom a serious indicator that should not be ignored. 6. New-onset diabetes. New-onset diabetes refers to the sudden development of diabetes in individuals who previously had normal blood sugar levels. This is particularly notable when it occurs in adults over 50 years old without obvious causes, such as changes in diet, weight, or lifestyle. Symptoms of new-onset diabetes may include increased thirst and urination, unexplained weight loss, fatigue, and blurred vision. In the context of pancreatic cancer, new-onset diabetes can serve as a significant warning sign. The pancreas plays a critical role in regulating blood sugar levels by producing insulin. When cancer disrupts pancreatic function, either by impairing insulin production or altering the body's ability to use insulin effectively, it can result in elevated blood sugar levels and subsequent diabetes. This connection is not entirely understood, but pancreatic cancer may alter the structure and function of pancreatic cells or release substances that interfere with normal insulin activity. In some cases, new-onset diabetes is the first noticeable symptom of pancreatic cancer, especially when other signs are vague or absent. It is important to note that not all cases of new-onset diabetes are linked to pancreatic cancer. However, if diabetes develops suddenly in the absence of common risk factors like obesity, family history, or sedentary lifestyle, it warrants thorough medical evaluation to rule out underlying conditions like pancreatic cancer. 7. Itchy skin. Itchy skin, medically known as pruritus, is an uncomfortable sensation that creates an urge to scratch. While it is commonly associated with minor issues like dry skin or allergies, chronic or generalized itching can be a sign of more serious health conditions. One of the lesser-known causes of itchy skin is related to liver or bile duct problems. The liver processes waste products, and bile ducts transport bile, a digestive fluid, from the liver to the small intestine. When the liver malfunctions or bile ducts are blocked, bile salts can accumulate in the bloodstream instead of being excreted. This buildup often results in intense itching, even in the absence of a visible rash. In the case of pancreatic cancer, a tumor pressing on or obstructing the bile ducts can disrupt bile flow, leading to the accumulation of bile salts in the bloodstream. This type of itching is often accompanied by jaundice, another hallmark symptom characterized by yellowing of the skin and eyes. Unlike localized itching caused by conditions like eczema, the pruritus associated with pancreatic cancer or liver diseases is typically widespread, persistent, and progressively worsens over time. It often intensifies at night, disrupting sleep and significantly impacting the quality of life. If chronic itching occurs alongside other symptoms like jaundice or unexplained weight loss, it is essential to seek medical attention promptly to investigate potential underlying causes, including pancreatic cancer. 8. Fatigue. Fatigue is a persistent and overwhelming sense of physical, mental, or emotional exhaustion that is not relieved by rest or sleep. Unlike general tiredness caused by overexertion, insufficient sleep, or temporary stress, fatigue associated with underlying health conditions is chronic and debilitating. It often interferes with daily activities, diminishes quality of life, and cannot be alleviated through typical restorative measures like sleep or relaxation. Fatigue can be caused by various factors, including psychological stress, infections, chronic diseases, and cancer. It is one of the most commonly reported symptoms in cancer patients, including those with pancreatic cancer, and differs from ordinary tiredness due to its intensity and persistence. Pancreatic cancer contributes to fatigue in several ways. 1. Malnutrition and nutrient deficiency. Cancer cells often compete with healthy cells for nutrients, leading to malnutrition. In pancreatic cancer, this is exacerbated by impaired digestion due to reduced enzyme production, limiting the body's ability to absorb essential nutrients and energy from food. 2. Loss of appetite and weight. A poor appetite further decreases energy intake, compounding fatigue. 3. Cancer-related metabolic changes. The body's energy usage becomes inefficient due to the disease, resulting in increased energy expenditure without sufficient replenishment. 4. Emotional and psychological burden. The stress of living with cancer, coupled with the emotional strain, can further intensify feelings of exhaustion. 5. Treatment side effects. Therapies like chemotherapy can exacerbate fatigue due to their taxing effects on the body, including nausea, anemia, and overall physical stress. This type of fatigue can have a profound impact on a person's life, making even simple tasks feel insurmountable. Recognizing and addressing fatigue in the context of pancreatic cancer is essential for improving patient well-being and quality of life. 9. Blood clots. Blood clots are gel-like clusters of blood that form naturally to seal wounds and prevent excessive bleeding. However, when clots develop without an obvious injury or fail to dissolve naturally, they can obstruct blood flow and pose significant health risks. These abnormal clots, known as thrombosis, can lead to complications such as deep vein thrombosis, DVT, which occurs when a clot blocks blood flow in a deep vein, often in the leg. If a clot travels to the lungs, it can cause pulmonary embolism, a potentially life-threatening condition. Unexplained blood clots can sometimes be an early warning sign of pancreatic cancer or other malignancies. This connection arises because cancer and its treatments increase the body's tendency to form clots, a condition called cancer-associated thrombosis. In pancreatic cancer, blood clots may result from 1. Substances produced by tumors. Pancreatic cancer cells release proteins and chemicals that increase the blood's clotting ability. 2. Reduced circulation. Tumors can physically disrupt blood flow in the veins near the pancreas, increasing the risk of clot formation. 3. Treatment side effects. Chemotherapy and other cancer treatments can further elevate the risk of clots by damaging blood vessels or altering clotting factors. Symptoms of blood clots may include swelling, redness, and pain in one limb, often the leg, as well as sudden shortness of breath, chest pain, or rapid heartbeat if the clot travels to the lungs. These symptoms require immediate medical attention, as untreated clots can lead to severe complications or even death. In the context of pancreatic cancer, blood clots are not only a medical complication, but also a diagnostic clue that highlights the disease's systemic impact on the body. Detecting and managing clots early can help mitigate their risks and improve patient outcomes. 10. Changes in stool or urine color. Changes in stool or urine color can serve as important indicators of your overall health, signaling anything from minor issues to more serious medical conditions. These changes should not be ignored, as they can provide early clues about potential problems within your body. Under normal circumstances, stool is typically brown, a result of bile, a digestive fluid produced by the liver that helps break down fats. Urine usually ranges from pale yellow to deep amber, depending on hydration levels. However, significant or persistent deviations from these normal colors may indicate underlying health issues. 1. Dark urine. Dehydration is the most common cause, and increasing water intake usually resolves it. Persistent dark urine, even with adequate hydration, could signal more serious conditions like liver problems, e.g., hepatitis or cirrhosis, or urinary tract infections. Blood in the urine, causing a pink or red hue, might point to conditions such as kidney stones, infections, or cancers in the urinary system. 2. Changes in stool color. Light, clay, or white stool. This may indicate a blockage in the bile duct, preventing bile from reaching the intestines. Causes can include gallstones, tumors, or other obstructions. Very dark or black stool, often a sign of bleeding in the upper gastrointestinal tract, such as from gastric ulcers or stomach cancers. In the context of pancreatic cancer, changes in stool or urine color are particularly noteworthy. The pancreas plays a key role in digestion, regulating enzymes that help break down food. A tumor in the pancreas can block the bile duct, leading to pale or clay-colored stool. The absence of bile reaching the intestines changes the stool's color and consistency. Dark urine. Bile pigments accumulate in the bloodstream instead of being excreted properly, affecting urine color. These changes may also accompany other signs of pancreatic cancer, such as unexplained weight loss, loss of appetite, and digestive issues. If you notice persistent changes in your stool or urine color, especially when accompanied by other symptoms like fatigue, jaundice, or abdominal pain, it's critical to seek medical attention promptly. These changes could be the body's way of signaling serious underlying conditions, such as pancreatic or liver diseases. Pay attention to your body's signals. Scheduling regular health checkups, monthly, quarterly, or annually, can help catch problems early, often before they become severe. Early detection and intervention are key to maintaining good health and improving outcomes for serious conditions like pancreatic cancer. Your health is invaluable, and being proactive about potential symptoms is one of the best ways to ensure long-term well-being. If you found this information helpful, consider sharing it with others to spread awareness and encourage a culture of health consciousness. Together, we can take small but meaningful steps toward a healthier future. Lastly, if you found this information helpful, we kindly encourage you to like the video and subscribe to our channel. By doing so, you're not only supporting us, but also taking an active step toward prioritizing your health and becoming more informed about critical health-related topics. Sharing and engaging with this content helps raise awareness, allowing others to benefit from the knowledge as well. Remember, your health is one of your most valuable assets, and staying informed is an essential part of safeguarding it. Take action when it matters most, listen to your body, trust your instincts, and seek medical advice when needed. Together, we can build a more health-conscious and proactive community. Let's join hands to create a future where awareness and preventive care lead to healthier, happier lives.